Welcome to my good friend, Dr. Venky Munikrishnan. Dr. Munikrishnan is a fellow colorectal surgeon. He is director of the Colorectal Surgery Institute at the Apollo Hospitals in Chennai, India. For those people who don't know, the Apollo Hospitals is a more than 70 hospital system throughout India. Welcome, Dr. Munikrishnan.
Hello, Professor Wexner. How are you?
Good, thank you. So perhaps following on my introduction, you might just give our viewing and listening audience a little thumbnail sketch of the size and magnitude of India, as well as your area in Tamil Nadu and the city of Chennai, just so people have an understanding of the magnitude of and population density of India.
Sure. Hello all. Hope all of you are safe at home. This is Venky from Chennai in India. We're in the southern part of India. India is a big country, as all of you know. We have a 1.3 billion population. The big cities are Chennai, Delhi, Mumbai, Calcutta, Bangalore, Hyderabad. The cities are very populous. In my city, in Chennai, we have a population of 8.5 million people. So it's a big city. Most of healthcare is delivered through private hospitals, at least 70 to 80%. There are government hospitals which are large, but in big cities. So the private hospitals support most of the healthcare across India as a support to the government hospitals. As far as healthcare is concerned, majority of patients pay from their pockets. I moved back to India about 10 years ago. Then the healthcare insurance was probably about 20%. Now I'm probably seeing 40, 50% of insurance penetration. So it's getting better. So that's the magnitude of population and healthcare we have across India.
So following on the magnitude, it's a little surprising to some people that the number of cases of confirmed COVID-19 disease is as low as it is in India. And I think you mentioned a population of 1.3 billion, and the latest numbers I've seen around about 10,000 confirmed cases, which is certainly less than in many cities or states in the United States, and well under countries like Italy and Spain and UK. Perhaps you could give us your views on why that incidence might be this as low as it is, touching on a few themes perhaps on testing and on governmental controls and the like.
It is a surprise to lots of people around the world. Say why a population of 1.3 billion has got according to today's numbers, probably 9,500 cases and 334 deaths. One could be that we're not testing enough. That is one. Two, the number of reported cases, again, people seeking health, as you rightly said, could be very varied, how people seek out or report these infections. So our first case reported with coronavirus was on the 30th of January. Our 100th case was on the 14th of March. And we reached 9,000 plus cases on the 12th of April. And current, as of yesterday, it was 9,434 cases. But the good thing about India is that we're a big country, and every year we have lots of infections, either viral or bacterial, as a regular outbreak. And so most of that, is being managed at the community level. We have a very strong network of healthcare workers across the country, which go up to the village level. And the way we managed it is the primary care is basic, but it's there and with a very good support from these healthcare workers. So what we're noticing is as soon as we heard or the government acknowledged that there is an outbreak in China, they started putting out information very early on, as early as end of February, early March, that there is an infection. And we used to get recorded messages on the phone. So if you ring someone, immediately there is a awareness message which said there is an outbreak of coronavirus. You need to prevent it by maintaining social distancing. If you're going to cough, take those precautions. So the awareness came very early in March. And the second thing was there's lots of information passed on radio, television. So across the country, there was lots of awareness. So that could have helped. And on the 18th of March, our Prime Minister, Mr. Modi, asked for a voluntary, not a lockdown, but a voluntary isolation of the entire country. And I think that was a good success, which probably preempted what they did, which came on the 24th of March for a 3-week lockdown, which technically ends tomorrow. But as India, as I said, has got 1.3 billion population. It's got 22 plus states, and most of the states have asked for an extension of this lockdown. So probably we're going to have another 2 weeks of this lockdown. Now, the reason for that could be several. One, that we're starting to test more now that we've got more kits available, which we've sourced from around the world. And as the testing goes up, we will see that the number of cases are also going up. They've also identified hotspots where these cases are being reported. So the big states are Maharashtra, where Mumbai is, Delhi, Tamil Nadu, where I am, where Chennai is. So these are 3 states which are leading. One of the important points to come out in the last month is that 1/3 of all these cases, or these 9,000 plus cases, is related to a gathering which happened in Delhi in mid-March. So there's no social distancing or isolation. So there's a big group of people who had visitors from abroad, from Iran, China, Indonesia. And from there, this 1/3 of these cases, they went to different parts of India and, infected their contacts. So what it shows is that social distancing and isolation is so very important to control this. Now that we've identified this group of people, they've been isolated, their contacts have been isolated, but it also shows that now that we're starting to test, so we've been very stringent. So people who had symptoms were tested until say 2 weeks ago. Now their contacts were also tested. Now whoever's reporting to the hospital and asking for tests are not being tested as of now, but I think they're going to open up the testing criteria. Anybody with say fever or walks into the hospital who's going to be screened, and if they have got any even mild symptoms, they're going to start testing. So we're going to see this infection rate rise up. But what we're not seeing is the proportion of critically ill people compared to the Western world. Now, most of the experts are not sure, and there are several theories being flouted about. One, it could be the weather, because already in Chennai we're seeing the temperatures are about 35 degrees. That's one. 2, malaria, for example, is endemic in this country, so we've all been treated for it at some point. 3, we've all been BCG vaccinated. So there's lots of theories which are floating around, but there's no strong scientific evidence to say this is why we're not seeing that many infections.
Interesting, certainly on the point of the BCG and the malaria, that especially since hydrochloroquine is now being touted by some studies as being efficacious in some cases. So limiting traveling with lockdown, India travels by rail. I mean, certainly there are flights everywhere, but it's known for its rail system as well. Has intercity travel been suspended?
So by mid-March, before the lockdown, all international travel was stopped, and from the time of the lockdown, all travel, absolutely all travel, domestic as well as train, buses, everything is shut down. Absolutely everything. So people are allowed to go get their provisions, groceries, supplies between 6 to 1 in the mornings. And even within the city, unless you're a healthcare professional or essential worker, you need to have a special pass to sort of travel within the city. Otherwise, you're stopped by security, police, and if you don't, they just seize your vehicle and completely strict. Of course, it's a big country, and lots of people live in small accommodations, so it is a challenging time. But I think we've done our best given the resources and what's available.
Has elective surgery been suspended?
From the time of lockdown, all elective surgery has been completely suspended. Emergency surgery is going on. So cancer, if it is urgent, we're doing it. Otherwise, we're just asking people to wait. So rectal cancer is different, obviously, because in our specialty, we can get some form of chemo radiation sorted out. With colon cancer, we've as of now asked people to wait until mid-April. But now, because the 2 weeks more extension is coming, we may have to deal with it. But they've identified hospitals for COVID treatment within the Apollo hospital network. Even Chennai, we have 8 hospitals in the city. One hospital, which is a 250-bed hospital, has been allocated only for COVID. And again, the government on sector, there are hospitals identified across the city. There have been several hospitals identified for COVID, but we're not seeing overwhelming surge of these cases. So that is a good thing so far, which is today is on the 13th. So yeah.
Let me just shift gears towards the end of our interview and ask you about another of the many hats you wear. You're also an internationally renowned educator in colorectal surgery and in robotic surgery. You host a wonderful meeting there every year, which I know unfortunately this year was canceled, in Chennai. education is shifting. So how are you adapting to teach people about colorectal surgery, about robotic surgery when they can't come to you in person?
Learning from your leadership, we've always had an element of online when people can't travel, get them online for a lecture. Based on those things, now that Zoom and Microsoft Team meeting platforms are available across the country now, most of these associations and groups are going online. So every day, more or less, there is 1 or 2 meetings available. So there's a wide choice for trainees and senior consultants to go online. And for yesterday, we did one for the Clinical Robotic Surgery Association of India. Yes, and we had Manish Chand, Emery Gorgon from the Cleveland Clinic, Ohio, and Delia Cortez from Madrid come online, along with about 160 delegates from around the country. And it is quick, safe, simple to share knowledge. And I think looking forward, once we all go back to hopefully normalcy soon, I think a big component of our education will go online, or at least it will be a combination of some physical plus an online component. I think it's the future. And we can get more people on board as well.
Well, I very much appreciate your insights, and I certainly do hope we return to normal, although I look forward to the continuation of video platforms in a very selfish way. I look forward to returning to Chennai, one of my favorite places, and enjoying the culture, the cuisine, and the education and the camaraderie when we're able to do so. In the interim, till I can see you in person, I wish you and your family safety and health through this pandemic. And hope we all come out of it. Well, we will never be unscathed. Our worlds will be indelibly changed, but hope we come out for the better in some fashion when this all ends.
Thanks so much for your time, and it's been great interacting and learning what's been going around the world. So hopefully we'll come through this stronger.
Yeah, we're all learning, and there has to be some benefit to all of this. As Scott Levin said in a presentation, that we can, make the worst of it, make the best of it. I mean, we're certainly going to try and make the best of it in some fashion. If it's improving clinical care, improving awareness, improving our habits, improving our ability to educate and to maintain social contacts and social networking remotely.
Sure, Prof. See you soon. Take care.
Thank you too.